Today's morning rounds, why doctors are urging patients to make eye exams a priority. The American Optometric Association says 25% of children already wear or need glasses by the time they enter kindergarten. Doctors now recommend that parents have the eyes of their school-aged children checked every year. Dr. Tamiesha Frempong is a pediatric ophthalmologist at the Mount Sinai Hospital in New York. Good morning, doctor.
Good morning.
So what can doctors even detect from babies so young? And is it even true that babies can only see black and white when they're just a few months old?
Right. So when babies are born, the visual system is still immature. So they can see light and color, like red and black and white and that kind of thing, but they're not going to make out fine details. Doctors at birth will check to make sure the child can at least see light. Does the child wince to light? That's a crude assessment of vision. And then they'll look at the eyeball itself, make sure it's structurally normal, and look for the red reflex, that dreaded red eye that we get in our photos. That's actually a good sign that the retina is normal and everything in the back of the eye is healthy.
This happened with my son, under the age of 10. A teacher pointed out, what are some of the signs that we should all be looking for that a child may have trouble seeing?
Sure. So obvious things would be eyes that don't stay straight, eyes that shake, eyes that wander, poor fixation, poor tracking, and then things as simple as squinting. If your child is constantly squinting when they're looking at things far away, that could be an indication that they may need glasses.
And what impact does it have on learning?
Oh, it's everything. For me, for example, when I was in the 3rd grade, I started failing my spelling test. And my teacher alerted my parents, you might want to get her vision checked. Imagine if that didn't happen. I could have been labeled a bad student, not focused, not serious. And I didn't even know I had a problem because the vision I was having at that time was normal for me.
Right.
And that's when I started wearing glasses.
I wish I could have used that excuse for my spelling. So at what age should people take their children to get checked?
So, like I said, vision screening starts at birth, and then around 1 year going, the pediatricians will check during those child visits. And then certainly by the time the child is about 3 to 5 years old, they should have a comprehensive eye exam, because there may be a problem with one eye that you may not be able to detect. So there may be a problem that they need glasses more on one side than the other. They may have strabismus. They may have a problem in the back of the eye.
I just think, doctor, how many times does a parent go for a parent-teacher conference and probably hear their kids not doing well in a subject, and maybe a lot of times the answer is vision problems?
Absolutely. Even things like misalignments of the eye can impact the ability to focus and read.
Yeah.
So those things do require a comprehensive eye exam.
Well, Dr. Tamiesha Frempong, thank you so much.
Thank you, too.
Good morning, right as we all get ready to head back to school. Some of us are already in school, yeah. Thank you so much.
Thank you, too.